Every decision we make as GPs is important. Sometimes they're very small and trivial, other times they can have a big effect on a patient.
There are many cases where, as the patient leaves, you question yourself and you think, have I done the right thing? Are they safe?
Every doctor's different, but I definitely think I'm more of the worrying type. Some people are better suited to managing that, but I definitely do worry about making sure I've made the right decisions and haven't missed anything, and I've given good enough care to my patients every day.
Hello, Robert.
Hello.
Hiya. So you're seeing Dr. Savage again.
Yeah.
So if you'd like to take a seat. Thank you.
Oh. Hi there.
Hello again.
Robert.
Hello.
Please come through.
Oh.
Pleasure to see you again.
Okay.
What brings you guys back to me today?
I can't think properly. Explain.
He's dizzy.
Right.
Dizziness, vertigo. Well, you can recognise he's confused.
I am struggling to walk.
Mm-hmm.
I'm trying to think and my head won't do it. I can see something. I know what it is, but I can't bring the name of it into my head.
What is this?
I know it, but it's
Hello, Doctor.
How are you today?
All right.
Great.
I've got, well, it was just a freckle.
Mm-hmm.
And the last 6 weeks, it really raised and got crusty.
Okay.
It's quite sore. I also have one on the back of this, on the back.
Right.
Came up really suddenly and quite large.
Mm-hmm.
And about 2 or 3 months ago, it's kind of split into two.
Okay. And then this one on the chest.
This
I
one
can
was
see.
just like a freckle for years.
That one's never
Yeah.
been raised at all. It just. Sort
It
of
is
starts-
slightly raised, actually, if you can see at the side.
Yeah, I can see that.
Quite slightly.
Have you ever had problems with skin moles or
Not
skin
moles,
cancers?
but I am
Nothing?
very sensitive. I don't like being in the sun, basically. I just go very red.
Okay.
Irish background, you
Yeah.
know what I mean?
Do you want to have a closer look at your chest first? Let's
Oh,
just
yeah,
see if we
sure.
can work out
Do you
what
want
we
to
might
take
want to
this
do.
off?
No, that's okay. Yeah. I can see. So this wasn't ever any bigger or more crusty at all, was it?
No, it was quite flat,
Mm-hmm.
but it was. I thought it was like an old age thing, as you get, you know. But it's been there a while.
So I'm not entirely sure what it is, but the fact that it's raised and it's itchy and it's sore,
Yeah.
I think what we try to do is we give you a cream to use,
Yeah.
which will be a combination of a steroid and possibly an antibiotic cream, just to use for a week, 10 days, and see if we can get rid of it. And if we can get rid of it, fine,
Yeah.
it's nothing to worry about.
Yeah.
If we can't, then you do need to come back in and we might need to send you up to the hospital to get it checked out.
Okay.
Okay? Can I have a look at the one on your back?
Yes,
Would that be okay?
certainly. I'll just take this off. I've got a short sleeve one.
All right, this one here.
Yeah, and
Okay.
now it's split into two.
Yeah, I see that. So, but this one we don't have to worry about at all. I know exactly what that is. That's something called a seborrheic keratosis.
Right.
They're a very common type of skin condition.
All right.
More common in fair-skinned people. Typically arise on the either chest or back. They're very common. They're nothing to worry about. So the cream I'm going to give you, we're going to put it on twice a day, just for the next 10 days. If in a couple of weeks' time this one on the upper chest isn't gone away, then do get back in touch. Okay.
Thank you so much, Doctor.
No
What was
problem.
your name again?
Dr. Ferdinand.
Ferdinand.
Pleasure to meet you.
Thank you.
Take care.
Bye-bye now.
Bye-bye.
Thank you very much.
No worries, lovely. Have a lovely day.
Bye-bye.
Bye.
It's it won't come.
Okay.
Phone,
Okay. Fine. What's this?
stick,
What's that?
plant.
Okay.
I'm sorry, I'm not doing this on purpose.
No.
The brain won't register quick enough.
As someone who lives with Robert, is this completely unusual for him?
No, he's it's catching.
It's catching.
This not being able to think of the word, but this is.
I'm not trying to make things difficult for you, but the reason I have to be specific is because there's lots of different causes of vertigo. It's a horrible thing. I can tell it's really distressing you. And most of the time, it's not anything serious at all. It could be due to an infection, even just wax in your ear.
Yes.
Those things aren't anything to worry about. But there is one cause, a stroke, which is totally urgent. We need to send you to A&E right now. Which is why I'm trying to be a bit pernickety about the story.
The severity of Robert's symptoms are really concerning me. The fact that he's not only got sudden onset dizziness, but also he's having some difficulty with finding words definitely makes me worry about the possibility of a stroke. Most people are familiar with the red flag symptoms of a stroke, like facial weakness, slurred speech, or arm or leg weakness. But a less common type of stroke is a stroke affecting the cerebellum, the part of the brain that's involved in dizziness, which is what Robert presented with, which is why we had to be quite thorough investigating the signs and symptoms.
Is this a sort of totally new, worse than normal type of issue?
Yeah, this is.
With the speech, just the speech?
It's worse today. When he first sat down and started talking, I thought.
If you don't mind just sitting on the edge of the bed here, please, Robert. I'm going to do a few tests. OK, touch your nose and touch my finger. Doesn't help that you've got a wonky finger. You touch your nose, touch my finger. Back and forth. Don't fall off the bed. That's not too bad. OK, and then with the other hand, do the same. It's nice and slow. That's fine, OK. I want you to clap your hands, but front, back, front, back, front, back, front, back. That's good. And the other side. Nice and rhythmic. OK, that's fine. And I'm actually going to ask you to stand up for a second again. OK. And I want you to put your arms out in front of you. OK, and I want you to just close your eyes. Just try to balance. That's good. OK, sit yourself down. I'm going to have a little look in your ears. OK, it doesn't help that you've got a ton of wax impacted in your ears. Both ears are well, the right ear in particular is completely impacted with wax. OK, I think you need to get that done urgently.
Once I'd actually done specific tests to look for a cause of a stroke and having taken into account Robert's past medical history, his previous problems with balance, and a 10-year history of confusion and problems with finding words in the past, I was reassured that this wasn't an acute stroke. Nonetheless, we need to do a lot of investigations to find out both why he's so dizzy and also why he's deteriorated in terms of finding his words.
If you were having a stroke, you wouldn't be able to name those objects. It could just be that, you know, this is a horrible experience and it's kind of disorientating you, but we need to make sure there isn't anything else that's going on causing an underlying confusion. I'm going to give you a little bit of medicine for this dizziness, which should help. I want to get some bloods done urgently, and then I should have the results by Monday. Okay, I'm hopeful that you'll start to feel a little bit better with the medicine. Take it easy over the next few days. It could be something as simple as that wax just pushing on your eardrum, but we need to be certain. So we'll get rid of that, do the bloods, and I'll ask them to book you in for a review on Monday. All right. Okay. Nice to see you.
Thank you.
Bye-bye.
Nice to see you again.
You too, thank you.
watching how you're walking.
I saw you sort of hobbling a little bit as you came in.
Yeah. It hurts walking around. It's agony.
When does the foot hurt the most?
Getting up in the morning, it's just horrendous. I literally limp every morning.
Terrible.
It's just like so painful. Like it's just agony to walk.
So is this hurting?
Yeah, yeah.
So it's red and it's painful here?
Yes.
Yeah.
If I sort of pressed up under here,
Yeah.
that's when most of the pain started?
Yeah.
Okay.
It's the standing. Yeah. It's not the walking with it, it's the standing.
I'm really not on my feet much at all because it's just killing me, do you know what I mean? Like.
Hello, welcome to the mobile surgery. It's Anne, isn't it?
Yes, it is.
Great. So you're seeing Dr. Razak today?
Yes, I am.
So if you'd like to take a seat.
Oh, thank you.
Thank you.
This is nice. Morning. Morning.
How are we today?
If I'm honest, I'm fed up.
Yeah, because I was reading through the notes and you've been a couple of times about the foot. So tell me what's been happening since I last saw you.
What I'm worried about, I've developed swelling now.
Okay.
Before, I had swelling around the ankle.
Yeah.
But now the swelling has been coming up my leg.
Okay.
And I've had that many infections in it.
Yes, and it started off with the sole of your foot becoming really scaly, really inflamed.
Yes.
And sometimes that can be infected, and you've had recurrent antibiotics, haven't you?
I've been on 5
antifungals, 5 lots of antibiotics.
5 lots of antibiotics.
And we referred you to podiatrist. I was reading the podiatry letter because they said you've got some on your hands now.
You've just that look a bit there, but that's fine, that's cleared up.
Okay. Have you got any on the right foot at all?
I've started getting dry.
You started, okay.
Yes.
Okay, let's have a look at both sides. Can you take your shoes off and socks off first?
This one is starting on this one.
Okay. Oh my God, that's really bad, isn't it?
And it is killing me.
Okay.
I can't hardly walk.
Okay. I need to speak to my consultant dermatology colleagues.
It's the swelling.
Yeah, you know what's happened as well? Because our skin is like the waterproof barrier against all of the other bacteria and things like that, all the bad things around us. But because your skin is so broken now, it's allowing all the secondary infection to come in. I agree, that at times you needed antibiotics, but antibiotics alone is not going to help you if we don't treat the skin. I think you've got a type of condition called palmoplantar psoriasis. It's the type of psoriasis that affects your palms and your soles of your feet. I'm going to give you some creams and whatnot, but you need a dermatologist, a skin specialist. That's really nasty.
And it's killing me.
Yeah.
I need to be truthful. I feel like crying.
Let me speak to my consultant colleagues because this is a long time now and I feel really bad for you.
I mean, the pain, this one, it's just so aching and sore, even to stand up. I mean, I go to any hospital, I don't care. As long as I can get looked at.
Because I think the routine appointment's going to take months, but, they need to see you sooner.
Okay, then, thank you.
Yeah.
Right, thank you.
All right, dear. Take care, mind how you go.
Right, thank you. Thanks.
Bye-bye.
Thank you.
Thank you very much. Bye-bye.
I like your nails.
Oh, thank you. I'm really happy you complimented them.
Yeah.
I've been waiting for someone to compliment them.
Hello, Megan.
Hiya.
Come on in.
Hiya.
Have a seat.
Nice to meet you.
Nice to meet you as well. Right, how can we help you today?
So, I was in a collision yesterday. I'm experiencing symptoms of whiplash.
Okay.
I feel a little bit better today, but yesterday it was very headstrong, lots of pounding, and the shock, obviously, it was very intense.
Tell me a bit about the collision. What happened?
So I was driving home from work yesterday, went to go get my nails done. I was at an island and there was a van on the right, in the right lane. He went really suddenly, so I kind of hesitated a bit. And as soon as I thought, oh no, I've hesitated, it just went boom, straight into the back of me.
Any idea how fast they were going?
It felt fast.
Felt fast?
Yeah. It almost felt like my head nearly hit the steering wheel.
And you were driving, you were wearing a seatbelt?
Yes, we're receiving.
Okay, and so the main problem you're experiencing now is sort of pain and discomfort around here?
Yeah, and shoulders
And
as well.
shoulders,
Quite
okay.
sore.
Anything going down into the hands at all?
Not that I can remember.
The nails are good though, so.
Well, I didn't make it to my nail appointment, so.
Okay, well, let me have a look at your neck. So stand up for me, turn around. I'm just going to press down your spine here, so just let me know if I cause you any pain here at all. That's all okay?
Yep.
And then if I press off to the side here,
It's a bit sensitive.
that's where it gets a bit more sensitive. Is it any more so or less so on that side?
I'd probably say a little bit more on this
A
side.
little bit more on the left side.
Yeah.
Okay, fine. A few movements I want to get you to do, so you can do this sat down if you prefer.
Okay.
So can I get you to put your chin on your chest for me? Good. And now can you look all the way up at the ceiling for me? Can you look over your left shoulder for me as far as it'll go? Yeah, a bit uncomfortable doing that one?
Yeah, a little bit.
Okay. And then all the way over on the other side onto the right shoulder. Good, all right. So you've got a good range of motion now. I appreciate, I can tell from your face that it's a little bit uncomfortable. You've got a good range of motion, which is really good. I mean, the nature of whiplash is in that moment of impact, the muscles in your neck kind of seize up to kind of protect your head.
Yeah.
And then that can result in them becoming a bit injured. And it does usually settle down with time.
Yeah.
Movement's really important, so a few times a day, just kind of get your neck going.
Yeah.
So I think anti-inflammatories are the best tablets to use, and that is tablets like ibuprofen.
Yeah.
So if the ibuprofen's not doing the job, we'll prescribe you something called naproxen, which is a little bit more effective. You can still use that alongside paracetamol as well, and you'll find that using 2 painkillers in that way for a period of time will be more effective than either one painkiller on its own. So usually pain can get worse for the first 2-3 days,
Yeah.
and then after that it starts to improve. So certainly by the time you're hitting sort of 5-7 days, things should be
Yeah.
hopefully significantly improved.
Perfect, thank you.
All right. Right, Megan, all the best.
Thank you, and you.
Take care.
You too, bye.
Thank you.
Thank you.
Bye.
Is it Omar?
Yeah.
Yeah? Do you want to come through?
Hello.
Hello. Hiya, I'm Dr. Razak. Are you Omar's?
Omar's mum.
Omar's mum. Omar, you've got such a young mum. I thought she was your sister.
Oh, thank you.
What can I
Very
do for
kind.
Omar today?
Basically, he keeps getting recurrent migraines, quite intense. He needs to lie down, he needs to sleep. It keeps getting more often now. Sometimes he feels dizzy and faint, and he gets nosebleeds quite often.
Mum's expressed her concerns there. Do you agree with those concerns?
Yeah, but I think she's over-exaggerating a bit because, you know, like nosebleeds. I just got that like twice and then...
Okay. Mums can always worry, we know this. Okay, so nosebleeds you've had twice. The migraines though? What about the migraines?
Yeah, I get them once every 2 months or something.
And then when you do get the headaches, how long do they last for?
2 days max.
So
2 days, yeah, it's quite
at least
significant.
sometimes if it starts in the afternoon, he sleeps all the way through up until next morning.
Okay. And the other thing as well, your mum mentioned like these faints and things. When did that happen? How many times have you had that?
I haven't had them for a long time now.
So see his scar here?
Yeah.
He was just having breakfast and he fell on his bowl of cereals and it pierced his
himself.
skin.
Yeah.
And we went abroad this December and I just heard this loud bang.
Okay.
He just went on the floor. It didn't last for more than a few seconds, but I don't think he was able to prevent it. It was such a loud bang and he hit the back of his head.
Did you know that you were about to fall? Could you feel that you're feeling
Yeah, I
lightheaded?
felt like it was going to happen
How do you know that it was going to happen? What were the signs?
because I could just, like, my vision was getting a bit weird.
And on one occasion, he made a dent in the wall of the house. He said he could not prevent tripping and falling.
Is there any history of epilepsy in the family?
No.
Because they're quite significant, aren't they?
Yes.
For you to dent things, to cut your face
Yeah.
in a bowl, it
Yes,
doesn't sound
I
like,
feel-
I feel a bit weak. It sounds more significant
I feel the
than
same
that.
as well, but he thinks I'm exaggerating. I am a bit concerned.
Yeah. what you're describing is almost like crazy drop attacks. You're hurting yourself left, right, and centre. I'm very worried about that. I think what I would do is I'll give you a good once-over. It's not a bad idea to get some bloods done, but I want to write to the hospital, to the consultant neurologist, to see whether or not, you know, these are significant. Omar's visit is triggered by his mum's concern that he's having regular episodes of what seemed like fainting. I'm concerned that they're more than the usual faints, as they sound more like drop attacks, given the degree of injuries that he sustained. A drop attack is a condition where a person would lose consciousness or lose power of their body and would drop to the floor. There are various reasons for this to happen, but we need to rule out neurological causes like seizures and also cardiac causes. Blood pressure's okay. Can you stand up for me?
Yeah.
You're so tall. Do you mind just lifting your top up for me?
Just lift it at the front.
And this.
Yeah, let me feel your pulse at the same time. Can you turn around so I can listen to the back? This one, I just want you to do deep breaths in and out through your mouth. In and out. And again. Okay, that's fine. Blood test will tell me why he's having nosebleeds, whether it's significant. It will tell me if you're short in any other things. I'm in two minds also to make sure that we should get an ECG just to find out why you're having this crazy. It's not normal. It's not normal. You know, for someone to fall and plant your face to the ball and cut yourself and dent the ball, that screams alarm bells. We need to find out. People fall for various reasons. They fall because their blood pressure drops. They fall because they've got abnormal rhythm in the heart. They can fall because it's a variant of seizures. So we'll work our way through. I think Mum's worried, rightly so. I think if you're my son, I'll be worried too. So, you know, let's get all the tests done. And, you know, for all you know, it could just be something really simple.
Thank you very much for your time.
Then. No worries.
Thank you.
Thank you
very much. Thank you. Bye.
Bye-bye.
Thank you.
Bye. Bye-bye,
This is my mum saying this. She said, when you next see a doctor, you must ask about cholesterol. Because in my family, they all have what they say genetically high cholesterol.
As we've got a bit of heart issues in our family,
Okay.
I thought I'd better just check it out and see what it was.
Is there a family history of heart disease?
Yes.
Yeah.
So it does run in my family, so I was getting a bit worried.
Because my dad had it before when he passed away. My mum's got it now.
My nan, my granddad, both sides. So we're a bit of a nightmare.
Heart problem, blood pressure, cholesterol.
Unfortunately, your genes play a big impact.
I'm 45 now.
Yeah.
I need to get it checked.
Richard. Hi, mate. Come in. I'm Dr. Ward. Hello. Come in, take your seat.
Thank you.
Nice to see you.
You too.
Right. Tell me what I can do for you.
So, for the last few weeks, months training, mainly football, when it's the intense cardio part of it, I get really, like, heavy chest palpitations. I don't know if it's just I'm unfit and I've had too many Jaffa cakes, but...
You don't look as if you had too many Jaffa cakes.
But I found out a few weeks ago that my grandma's got, I think it's called cardiomyopathy, I don't know how to say it.
Okay.
So my mum got tested for it and she hasn't got it.
Yeah.
But I'm hoping it's nothing, but I just want to get it checked.
Okay. Cardiomyopathy is a structural and functional alteration to the heart muscle, leading to dysfunction and many symptoms, which we would need to investigate thoroughly. When did these symptoms start for you? This is only after you found out your grandma had this?
Yeah,
or?
I feel like there's a bit of anxiety with it as well, because once you know that it's in the family, it messes your head a little bit.
You've done the right thing, and I think you do need to be examined. Probably a few investigations to be done to have a little look and see what we can find. So if you pop your arm out of that, that'd be great.
Yeah. Sure.
Yeah, take it off if you could. I think that's probably a good idea. Good. Have a sit down again. How long have you been playing football, Paul?
Since I was about 6 maybe, but I've just started Gaelic football again, which...
Gaelic football?
Yeah.
It's the equivalent of Aussie rules.
Yeah, pretty much.
In fact, there's Gaelic football's only played in Ireland, well, roughly. Aussie rules only played in Australia, so there's no international teams, but apparently once every year they play against each other. They play one game of Gaelic football, one game of Aussie rules. They both win the games that they normally play and then they go home happy.
Yeah, well, I'm moving to Australia next year, so I might give Aussie rules a go as well.
Have a go, mate. Yeah, up a little bit at the moment, the top level. What I want to do is have a little listen to your heart, if we could.
Yeah. Shall I stand up?
Let's stand up for a sec. Yeah, can you lift that up for me? Okay, what I want to do is just breathe nice and normally. Don't breathe too hard. Okay, good. Pop that down again. Okay, your pulse is nice and regular and it's, you know, I can't see any problem with it. When you listen to your heart, though, it sounds like there's a little murmur, okay? So a murmur in a heart is where some of the blood flow, when it goes through the different valves, if there is a problem with a valve opening completely or closing completely, then it leads to some turbulence, and that sometimes you can hear that. It's a very inaccurate way of judging what's going on, okay? And sometimes, if your blood pressure's up a little bit because you're a bit anxious or nervous, and you come in and you're having the examination, then your heart's pumping a lot harder, and so therefore sometimes you'll hear a murmur in any case, okay? So I think from that perspective, you know, we do need to try and work out what's going on, okay? So we will refer you, okay? We'll get some blood tests done as well so that we've got some baseline things looking at cholesterol levels. There's something called a BNP, which is a test that we look for with people with heart failure, which sometimes comes from a cardiomyopathy. I don't think you've got heart failure. Okay. I'm hoping that absolutely at the end of it that we can just say, well, actually, there's nothing wrong, and then we can reassure you and you can go off to Australia and enjoy yourself.
Fingers crossed.
In the meantime, if these symptoms are getting worse, okay, that if you're playing and it's getting to the point where you don't have to do much exercise and it's coming on, then we really need to know about that because we'll try and speed things up for you. Good on you.
Thank you for your help.
Okay.
Thank
See
you.
you later.
Take care.
Yeah, cheers, mate. Bye-bye.
Morning. Welcome to the mobile surgery. Is it Thomas?
Yes.
Okay, lovely. Take a seat for me.
Thank you. Say hello.
Morning. Hello. Hello, gorgeous.
Oh.
Hello. Are you not very well today?
Not for the past few days.
Oh, dear.
Good morning. Hi there.
Good morning.
Is this Thomas?
Yes.
Nice to meet you. My name's Dr. Savage. Please come through.
Well, it's not nice to meet you, but you
Yeah,
know.
of course. Yeah, I know you don't. This is probably the last place you want to be. Okay. Are you mum?
Yes.
So tell me what's been going on with Thomas.
So on Monday he was in nursery. They told me he had diarrhea. I took him home. I gave him some rice soup, but rice with a bit of chicken. He ate a bit of that, but I can see he was off, like he wasn't himself. And then on Wednesday he started having fever. He reaches 40.1, and now he's refusing his milk as well. And he refuses water, which normally he will play with it and drink the whole cup.
In terms of the fever,
Yeah.
what's been happening with that
So fever, he's having fever every 6 hours.
since Wednesday?
Yeah.
Always spiking up to
Yeah.
40?
Yeah.
Okay. Do you think he's peeing a lot less than normal?
I would say a lot less, yeah.
I mean, I'm not too worried about him refusing food. That's
yeah,
common.
because that's
yeah.
normal. Wait, mommy, wait.
Sorry, buddy.
Here you go. Yeah.
If you just pop him on the on the couch there for me. Sorry, bud.
The wheels on the bus.
Go round and round, round and round, round and round. The wheels on the bus go round and round all day long. You've got to help me out with that singing. You can't just set me up and then leave me to go solo.
He's...
Actually, give him a big cuddle while I just pop this in his ear. Sorry, dude. Sorry. That's fine. That's great. That's all good. Hey, bud. Sorry, buddy. It's going to be cold.
Wow.
Is that cold? Is that chilly? Ooh, is that chilly? That's all good. And if you just lay him flat on the bed for a second, this is going to be horrible for you, bud. Oh, big cold hand. His skin's all looking normal. That's fine. Let's get him his clothes back on, otherwise he's going to get cold and miserable. So I
Yeah.
definitely think it's a gastro bug. But what reassures me is he's peed this morning. If he was
Yeah.
really dehydrated,
He wouldn't.
he wouldn't have peed this morning.
Yeah.
If he was really dehydrated, I know he's a bit miserable, but he wouldn't be... He wouldn't be smiling and walking around, engaging with me.
Yeah.
You know, I'm worried about kids who are floppy. Even kids who scream and are crying, I'm less worried about. So all in all, it's quite reassuring.
Yeah.
Do you want to sit back down? I'm going to finish my quick checks. He's going to hate this. Hold him tight against you and then one hand on his forehead so he doesn't like headbutt me. Hey, buddy, that's good. You got a little bit of drool there. Hello, guy. Oh, sorry, dude.
Have you managed to...
Yeah, done. Done. Sorry. I'm satisfied. There's not anything else going on other than his stomach.
Yeah.
If he's still having diarrhea by Monday, his nappies dry up,
Yeah.
then that's when you would need to go back to the hospital, persevere with whatever he's happy to drink. So
Yeah.
whether it's Diorolite or whether it's water, just get those fluids in. Don't worry too much about solids. And I would expect him to turn the corner. All right.
Yeah, thank you so much.
Nice to
it's
see you.
reassuring to hear that he has actually, you know,
Yeah,
after all I've, witnessed
It's not easy. How are you coping, by the way? Because, I mean, I've got a 6-month-old at home, so I know the fatigue that you're experiencing, maybe. Bye-bye, buddy.
Thank you so much. Thank you.
Bye.
Bye. Thank
See you,
you.
fella.
Bye.
Avinash,
Right.
hello.
Yes.
Just,
Looking very smart.
Space, thank you. All right, just mind the side, yeah. Take a seat then.
Thank you.
Okay. Hi, how are you doing?
Not too good, otherwise I wouldn't be here.
Of course. Only saw you a couple of weeks back, wasn't it?
Yes. You know, when I came last time, it was my asthma that was playing up.
Yes.
My asthma has settled down.
Okay, good.
But now my biggest problem at the moment is I get blackness in front of my eyes.
Right, okay.
It has happened before. It's getting more frequent now.
Right.
It is just like as if, a black cloud comes in front of your eyes.
Okay.
I don't completely black out. I can see like a bit, but not much.
Yeah.
Everything is very hazy. Thursday, about this time when I had it, it lasted 20 minutes. Then it passed away. In the afternoon, it happened again after a couple of hours.
Right.
And it lasted half an hour.
Okay.
Friday, I had it again and it lasted 40 minutes.
Okay.
And then I thought, well, it's time to go to the A&E.
Yes, of course.
So I went to QA. As soon as I said my eyes, he said, you need to go to the Midland Eye Hospital.
Sure.
The doctor there. He said, there's nothing wrong with your eyes.
Okay.
I said, but why am I getting this blackness? He said, we don't know.
Does the whole of the vision get obscured?
Yes, both eyes.
Both eyes. When it happens, though, do you get a lot more breathless or any chest pain?
No, I don't get any pain.
No pain. Okay, fine.
The thing is, when I'm having this blackness, I don't get a pain anyway.
Sure.
But after it has passed away, I get straight headache.
Even though Avinash's symptoms don't seem to fit with anything serious, like a heart attack or a stroke, I'm still a bit concerned there could be an underlying cardiovascular cause, such as heart arrhythmia, which is an irregular heart rhythm, or a problem with the heart valves. So you said you've had this before. How long ago was it before last week that you last had it?
It started a few years back. When I had the first time, I didn't think much of it. I had lost it. And after that, it was a few months. But as the time has gone on, the frequency...
It's been getting more frequent.
Getting more frequent. This is too much now. Yesterday, I had it again.
Okay.
I don't know whether it is my heart or whether I'm getting a stroke, and I'm really worried.
Yes. So I'm just going to do some tests on the nerves in the face. So first, just keep looking at my pen, okay? Still seeing one pen? Yeah, okay, great, okay. Do you mind just popping your glasses off for a second? That's great. So just look straight ahead for me. I'm just going to shine a light on each side, all right? That's fine. So, I'm just going to touch your face. Okay, can you feel me touching both sides there? Does that feel the same, both sides? Yeah. Okay, feels the same on both sides of the face, yeah? Good. Give me a big smile, big as you can. Can you blow your cheeks out at all? That's okay, that's all right. So, examination was normal, okay, which is good, all right? But obviously it doesn't explain what's going on with these symptoms.
So what shall I do?
The concern is that obviously how frequent and how long they're lasting for, isn't it?
Yes.
The underlying concerns are if it's a neurological or a cardiac issue.
Yes, that's what I'm worried about.
Yeah. You know, yes, you need to see a specialist, okay, to see why these episodes are happening. 'Cause it's almost like you're almost fainting, almost losing consciousness, but not.
Yes.
Your eyes are fine, but what's causing this almost blackout?
Yes.
There's no obvious signs of a stroke or mini stroke or even heart attack at the moment. Obviously, if you get any chest pain, any severe shortness of breath, severe palpitations, sudden weakness one side of the face or sudden weakness in one arm or one leg, it's 999 straight away, okay? So you must call 999 straight away if you have any of those symptoms, okay? Those are signs of, you know, a heart attack or a stroke, all right? But otherwise, I'm going to do an urgent referral, okay, to the hospital to look for the cause of, you know, why you're getting these episodes. In the meantime, however, I think we should get some up-to-date blood tests here at the surgery. I don't think we've had the proper blood tests for a while, so I think we make sure there's nothing else underlying like anemia, any other deficiencies, and we can arrange also an ECG at the surgery as well in the meantime. Do you have any other questions at all?
No, if we can get cracking on that, that would be something.
Yeah, I'll try my best, okay? All right.
Thanks.
Thanks.
Okay, great.
Oh, God bless you. Thank you.
Okay, yes, you do.
Okay, thanks.
Okay.
Thank you,
All
dear.
right, you
Thank
take
you
care.
very much.
Nice to see you.
Yes,
You take care,
have a good
all
day,
right?
yeah.
You know when you're in an aeroplane, you're coming down rather fast. But that's how my ears feel, but I can't pop them. They won't pop.
If you go up and down the lift very quickly, you feel like your ears is about to pop.
You're talking to me now, it sounds like I've got a set of headphones on.
Okay.
Like when you get water in your ear.
Are you able to pop that ear at the moment, like you would on an aeroplane?
Hold her nose and try to blow.
Do you mind doing that while I'm looking? So when I say go, OK?
Go. Not through the mouth. You need to close the mouth, close the nose, and go.
Did that pop? No.
Hello, Manjit.
Hi, yes.
Come on in.
Come on in.
Hello to you both.
Hi.
Welcome.
Thank you.
Have a seat. My name's Dr. Ferdinand.
Hi.
Right. So, Mum, you're the patient, aren't you?
I'm the patient.
Right. How can we help you today, Manjit?
My ear has been hurting. I'm getting pains and like there's a funny sensation in there.
Have you had anything else going on, like any coughs, colds?
No,
temperatures?
nothing. No.
No fever?
No.
No. Any
No.
discharge coming out of the ear?
No, I feel as though there's liquid, but I do that. Like, you know when you get water in your ear? But nothing.
Let's check a few things out. Right, I'll start off looking in the good side, if
Okay.
that's okay. Thank you. Good. All right, let's look at this one. Nothing really obvious going on in there. So there's certainly no infection, there's no
Yeah.
wax, there's nothing in the ear canal itself. So I wonder if there's something going on more with your middle ear, which is sort of behind the eardrum. Are you able to equalise your ears or pop your ears, we call it sometimes, like when you don't go on an aeroplane?
Just blow.
Yeah.
So that's the sensation sometimes. Yeah.
There is a tube that goes from the back of your nose to your ear called your eustachian tube.
Right.
Yeah. When we do this, we're forcing air up the eustachian tube and into our middle ear. And sometimes that tube can become blocked.
I can't do that. Yeah.
Okay.
It just feels as though it stops.
Yeah, can you do the left one?
Yeah, that one's okay.
Yeah, but it's the right one. Okay, so
Yeah.
this tells us that that's probably what the problem is. So there's some things you can do to help and open up your eustachian tube. The first is to try to unblock your nose as best you can, so blowing your nose, but also you can get some Sudafed tablets, like a decongestant tablet.
Okay.
Second thing is moving your jaw around. So you can wiggle your jaw left, right,
Okay.
like that.
Yeah.
But you're not
That
gonna do,
hurts.
Well, exactly, but you're not going to do that for very long. So I usually advise get yourself some chewing gum and chew that. Because if you're chewing gum, you're going to
I'm good
naturally...
at chewing gum, Dad. Chew gum a lot, so that's surprising.
OK, we're going to keep doing that along with the Sudafed tablets, and then the final thing is to pop your ears.
OK.
Now, if you want to selectively pop your... Well, you need to do your right ear, don't you? So if you want to do your right ear, the way to do it is tuck your chin in and tilt your head so your right ear's up, other way.
OK.
That way. And then when you do it, you're selectively trying to pop your right ear.
OK.
Once you are able to equalise and pop that ear, you need to keep doing it because it will re-block very easily.
OK.
So you need to keep popping it 2 or 3 times a day for a few days, and then eventually it will stay open and your symptoms will hopefully settle down and go away.
OK.
Simple as that.
Thank you.
OK.
Yeah, that's brilliant.
No problem.
Cheers. Thank you.
All the best.
Thank you. Thank you, bye.
You chew gum a lot, though.
I know. All the time.
You're chewing it right now.
Thank you very much. Have a lovely day.
You too. Bye-bye.
OK, mate.
Yeah,
We'll
thanks
sort
for
that out.
stopping you. Sorry, yeah. All the best.
OK, see you later.
Thank you.
Should we go now?
Cool. Can I get a high five?
Thank you so much.
Right, nice to see you. Take care. Cheers. Bye-bye.
One of the best things about travelling around the country in the mobile surgery is not just meeting different communities and seeing how different surgeries rise to the challenges that come with their population, but also seeing different clinicians and their passion for the job, their genuine love of the job has made me feel so optimistic and not fearful but excited about the next 30 years of my career in the NHS.
Is it just blood on the dressing you're seeing, or does blood just flow out?
Blood's flowing out.
What did you clean him out with?
I use hairpins.
Hairpin?
This is the nasty part.
Okay.
It's quite warm to touch. It's still quite angry.